Hey guys, how are you all doing today? It's such a pleasure to be with you again on a Sunday afternoon, evening, depending on what part of the world you may be in. I will be talking about viral hepatitis today, and that just means the hepatitis that is caused by viruses. So the goal of this whole thing is to increase an awareness and understanding of viral hepatitis and the disease that cause it. So my name is Edith once again, and I am an educator. I'm a nurse educator. I teach nurses and I teach patients. So what is hepatitis? What is hepatitis? I'm sure you probably have been to your doctor's office and, or someone who has hepatitis and you're wondering, is this going to kill me? Am I going to die? Is it treatable? How did I get it? And all of that stuff. So hepatitis is just an inflammation of the liver. It's a disease. It's a viral infection that causes the liver to be inflamed, meaning it causes the liver to swell. It causes the liver some kind of swelling, in simple terms. And there are 5 types of hepatitis, viral hepatitis. We have hepatitis A, hepatitis B, hepatitis C, D, and E. So there are 5 different types of hepatitis, and 5 of these hepatitis are caused by different viral organisms, and then they're handled differently also. But now, hepatitis A and E are usually gotten through the oral or fecal route. So let's say you go to a restaurant to eat and God bless your soul, the person who made the food has hepatitis A or hepatitis E and didn't wash their hands well after wiping their behind, and then they use the hands to make you some good food, and then you catch or you contract the virus. So that's how hepatitis, and then you can also get it from drinking water that is infested by people who have hepatitis A or E. So in certain parts of the world where people do not have good toilet systems, or good sewage systems, and the stools get into the water and then they drink it, they could have hepatitis A or E. Now, the 2 other ones that are totally different, 3 actually, hepatitis B, C, and D. Those are the ones that are totally different. Now, hepatitis A and E, well, they are usually acute and they are self-limiting. So what I mean is most times they just go by themselves. There's usually no treatments, for hepatitis A and E. But of course, there are vaccines for hepatitis A. Now, hepatitis B, C, and D are usually caused by blood or body fluid. So let's say, for instance, someone decides to go share some syringes, in the course of drug abuse, or even in the hospital. Like those of us who work in the hospital, we're usually, or most of the time, we're exposed to hepatitis B, C, and D because, we're in constant contact with people who have, these viruses, or we're in constant contact with blood and body fluid. So hepatitis B, C, and D are usually caused by blood and body fluid that are contaminated. All right. So the next I will talk about is treatment. I already talked about treatment of hepatitis A and E. They're self-limiting. You do not need, most of the time the doctor will just, maybe treat the symptoms, and the liver will usually heal by itself in a couple of months. Now, let me tell you what, for those of you who do not know where your liver is right under your right rib cage. It's kind of protected by your right rib cage. So right under there is where the liver is. So there is also no treatment for hepatitis E, and your doctor will usually ask you to drink a lot of water, get some rest, avoid alcohol, because alcohol can also cause hepatitis. And then you also want to check with your doctor before taking any medication, because there are some medicines that are really hepatotoxic, meaning that they're very toxic to the liver. The liver cannot process them, or it might damage the liver. Now, hepatitis D only occurs with hepatitis B. So if somebody has hepatitis B, then they're prone to having hepatitis D. Now, the big 2 are hepatitis B and C. And how do you get them? Both of them lead to chronic diseases as seen in millions of people who have liver cirrhosis, which is a scarring of the liver, or liver cancer. Now, about 1 million people die every year from hepatitis, viral-related hepatitis. So not alcohol hepatitis, but viral hepatitis. A lot of people, because people don't get tested, people don't know, people are having casual sex, people are sharing needles, people are having babies even while they have hepatitis B or C. Now, the global burden is huge. It's huge. A lot of people have cancer, like I said. A lot of people have died, and this number keeps increasing because people do not know about these viruses. Now, only 1 in 5 persons exposed to hepatitis B and C have symptoms, actually. So let's say you get exposed, you share a needle with someone, or you get stuck by, a needle from someone who has hepatitis B or C, or you have sex with someone who has hepatitis B or C, and it doesn't usually show at that initial time, but both of them have been said to cause a lot of deaths. Now, a co-infection, if one has HIV, which is another virus, they're usually prone to having hepatitis B and C, because guess what? The immune system is already compromised. Now, people can get hepatitis B from sexual contact, from mother to child transmission. And when I say sexual, it could be vaginal, it could be anal, whatever, anything that involves transmission or transmission of blood or body fluids. It could be during delivery. So if a woman who has hepatitis B or C doesn't get adequate treatment and then she's having a baby, she could transfer that to the baby. It could be during blood transfusion, and that's why it's very important before you get blood, you want to ensure that you're getting blood from the right source, because the blood should be screened for hepatitis B and C. Then you can also find them in people who are living with HIV. Now, hepatitis B is, like I said, it's just related to hepatitis C is related to hepatitis B, or they kind of share the same mode of transmission, which is blood-to-blood contact. You want to try as much as possible to avoid transfusions that you're not sure if they've been screened or not. You want to, sometimes they're getting from sexual contact, but it's not as often as hepatitis B. Now, both hepatitis B and C are many times more infective than HIV. Now, research has shown that they usually appear for about 1 to 4 months after the individual has been infected, and you could find them about 2 weeks after the individual has been infected. Some people, like children, may not necessarily show symptoms. Now, acute hepatitis B lasts less than 6 months. Your immune system can likely clear it out, but then the chronic one can last for as long as the individual is alive. Now, I'll talk a little bit about some of the symptoms that you'll be looking out for, or if somebody comes around and says, "Hey, I think I have hepatitis B or C or D," you want to look out for these symptoms. The first is abdominal pain. They can complain of abdominal pain, especially in the right upper quadrant. So they could complain of pain in the right upper quadrant, which is the right, when you divide your stomach into 4, the upper right side of your stomach is called your right upper quadrant. Now, they could have dark urine because of breakdown of bilirubin. They could have fever, they could have joint pain, they could have loss of appetite, they could have nausea and vomiting, they could be weak, and they could be really fatigued, and then they could be yellow, jaundiced, and sometimes even in the eye. You can see them on the skin or in the eyes. They could have yellowing of the eyes and the skin. So that is called jaundice. Now, the main preventive measures for hepatitis B and C that I want you all to know about is vaccination. Hepatitis B vaccines are available for newborns as soon as they're born. At 0 month, they get the first shot. It's usually a 3-dose a vaccine. So the first is given at 0 month, and then 2 months, and then 6 months. So even adults can get hepatitis B vaccines. You want to also ensure that you do not share needles with individuals. Regardless, it doesn't matter if you know their status or not, because if they are chronically infected, their blood the blood sample or blood test might not necessarily show all the time, so you want to be very, very cautious, when you're being exposed to blood, when you're being exposed to body fluid. If you're having sex with a partner who is not, your husband or your wife, you want to, as much as possible, protect yourself. Now, promote safe sex, use condoms or abstain if you can. Ensure that any medical equipment, I know sometimes people go for surgeries and they don't even know what's used on them, but please, if you're in a position to operate, if you're in a position to cut someone's skin, please ensure that the equipment are properly sterilized. You want to also counsel people like we're doing today. I hope you can also teach someone about the mode of transmission of hepatitis B, C, and D and how to prevent them. You also want to raise awareness, just like we're doing today, trying to raise awareness, trying to reduce the number of people that would be exposed, and trying to increase the number of people that can manage this, their symptoms or the viral disease processes adequately. Now, like I said, usually there is acute forms of hepatitis B and C are self-limiting. Sometimes they just clear by themselves. But of course, a lot of people have been treated with antiviral medication, but sometimes some of these medications can be really, really expensive. So I would really, really suggest that if you're having any of these symptoms, your urine is dark, your eyes are yellow, you're having right upper quadrant pain, and you've been exposed to blood or body fluid, someone cut themselves and then, the same needle or whatever stuck you, it's very important that you go see your doctor, and they need to test you for hepatitis B. Usually they will give you they'll give you the vaccine right away if you're not sure you've gotten the vaccine before. Now, if you know you've been exposed, please, as much as you can, try to find the nearest the nearest doctor's office, because again, if it's not treated, this could eventually or consequently lead to liver failure, liver cirrhosis, meaning a scarring of the liver, and liver cancer. And of course, you only have one liver, and if your liver damages, trust me, it is usually very difficult to find a liver donor. So please stay safe. Do not take medications if you're not if the doctor did not prescribe them. Try as much as you can to prevent yourself from self-medication. I know that a lot of people in some countries, people will just go to the pharmacies and buy medications without reading the labels. Some of these medications are actually very toxic to the liver and can cause a lot of damage. So until I meet you again next week, thank you so much for watching, and I hope you have a wonderful, wonderful new week. Bye-bye.